Okay, this is your lateral pterygoid plate, and this is your medial pterygoid plate. And this is your lateral pterygoid plate. This is the pterygoid hamulus. Okay, now the next one is ethmoid and sphenoid bones. Those are the unpaired, found in the midline, bilaterally symmetric bones. They contribute both to the neurocranium and viscerocranium. The inferior nasal concave is its own bone. Okay. The greater wing of sphenoid contains three foramina, that is rotundum, ovale and spinosum, which is in the medial cranial fossa. Now the ethmoid, the components of the ethmoid bone is the cribriform plate, crista galli, lateral plates, and perpendicular plate of ethmoid bone. The function of cribriform plate is olfactory foramina is present. Crista galli attaches to falx cerebri. Lateral plates contains ethmoid sinuses, superior and middle nasal concave. Perpendicular plate of ethmoid bone contains superior part of nasal septum. The sphenoid bone has a hollow body, greater wings, lesser wings, medial and lateral pterygoid plates. In the hollow body you have the sella turcica and the sphenoidal sinuses. The sella turcica is where the pituitary gland is situated. Greater wings of sphenoid is lateral orbital wall. It forms the lateral orbital wall and the roof of infratemporal fossa. The lesser wing of sphenoid forms the roof of the orbit and superior orbital fissure, which contains the optic foramen. Now the medial and lateral pterygoid plates. The lateral pterygoid plate is an attachment for both the medial and lateral pterygoid muscles. Medial pterygoid plate ends as a hamulus. Tensor palatin muscle hooks around this. So this is important. Lateral pterygoid plate is an attachment for both the medial and lateral pterygoid muscles. Medial pterygoid plate ends as a hamulus. The tensor palatin muscle hooks around this. Now the bones of the orbit is what all bones form the orbit? Frontal, maxilla, zygoma, ethmoid bone, sphenoid bone, lacrimal and palatine. Now this is the frontal bone. This is the depression of for the lacrimal gland. This is the lesser wing of sphenoid. This is the superior orbital fissure. This is the greater wing of sphenoid. Inferior orbital fissure. This is the infraorbital groove. Zygomatic facial foramen. Zygomatic bone. Infraorbital foramen. This is the maxilla. Posterior lacrimal crest. Anterior lacrimal crest. Lacrimal fossa. Ethmoid bone. Optic canal. Nasal bone. This is the anterior ethmoidal foramen. This is the trochlear pit. This is the posterior ethmoidal foramen. Supraorbital notch. The orbital contents are, you can see figure 1 to 7. This is the ophthalmic artery, which is a branch of the internal carotid artery, is the major blood supply to the orbit and the eye. It enters the orbit with the optic nerve through the optic canal. Now the zygomatic bone is also referred to as the malar and the cheekbone. It is located in the upper and the lateral part of the face. Prominence of the cheek, part of the lateral wall. It forms part of the lateral wall and floor of the orbit. It also forms part of the temporal and infratemporal fossa. It articulates with the maxilla anteriorly and the temporal bone posteriorly. Zygomatic arch is formed by temporal process of zygomatic bone and zygomatic process of temporal bone. Temporalis muscle passes deep to zygomatic arch. The masseter muscle originates from the zygoma and zygomatic arch. You can see here, this is the orbital portion of the orbicularis oris muscle, orbital septum, superior fornix or conjunctival sac. Then this is the insertion of levator palpebra superioris, lens. Then this is the cornea of the eyeball. This is the iris. the iris, inferior oblique muscle, the sclera. This is the levator palpebrae superioris muscles. This is the superior oblique muscle, superior rectus muscle. This is the optic nerve. Then this is the inferior rectus muscle. And this is the maxillary sinus.